Hello, welcome back to the Tower Yoga Podcast. I'm very happy today to be here with Dr. C, a doctor in the community with, I think, a really important message to share. So, Dr. C, thank you for being here. You're more than welcome to introduce yourself. If there's anything that you would like us to know about you, then now's the time.
Cool. Well, yeah, thank you for having me on the show today. Like you said, my name is Andrew C. I'm a family medicine physician doing all things, but specializing primarily in a lot of LGBTQ plus health, gender affirming care, HIV prevention. So I think that I'm really passionate about creating spaces for patients to feel safe, respected, fully seen and heard. So I'm glad that we can get on the podcast today to kind of talk about some of the things we can do to help our community a little bit more.
Absolutely. And while I want to kind of dive right into the heart of that message, I am curious, and maybe other listeners would be curious, like, what was the initial inspiration? Like, did you get into medicine like with that heart, or is that something you discovered along the way?
I absolutely did not get into this that way. I actually was planning doing more global health and looking more kind of internationally at things when I was in the military. So I was Navy active duty, and I had a patient that was transgender, and I was the only queer physician on base. And so they're like, well, you're gay, so maybe you can help take care of him. And I realized just kind of going into it, just how much, the disparities in healthcare are for particularly for people that are gender nonconforming or things like that. So that really showed me that we have a big opportunity to help a lot of people. And I think the other big thing for me too is that growing up as a gay kid in the South too, I didn't really have a lot of safe spaces to talk about things and to really kind of understand what it means to be gay. So I really wanted to create a doctor's office where people feel comfortable talking about all aspects of their health and shouldn't feel like they're treated any differently because of the things that they're going through. So that's really how I got into it. And then coming into community from there, again, the Central Valley has a huge, huge need for a lot more inclusive services as well as just more primary care in general. So that's where we kind of have helped open this clinic up and really expanded it from there. So it's been pretty cool.
Wow. Wow. Beautiful. Beautiful. Thank you for sharing. So, like, what specific barriers to healthcare are the LGBTQ plus specifically like this community up against? I mean, I can speculate, but I'll just turn it over to you.
Yeah, so there are a lot of barriers, and I think that really we kind of look at it as both like more systemic, but also more interpersonal barriers. So one of the things we see a lot that I've run into a lot is just the knowledge of providers about knowing how to talk to people in our community, knowing what kind of tests that we need to get done if there's differences, or kind of just feeling comfortable bringing things up or talking about pronouns or all those kind of things. I think there's a big fear of discrimination. I know for myself and a lot of my patients, we've had a lot of previous negative experiences in healthcare that's really kind of off-putting. Another big gap is that an insurance covering for gender affirming care. So I think that that's kind of really a big part of it is like I said, both from the healthcare side of things and then from the societal kind of side of things that we are seeing more of a delay in care for things. I'll give you an example of one that I had, back in November? So he had been seen by a primary care physician within Fresno, wanting to get pre-exposure prophylaxis for HIV. And the physician that he had saw wasn't comfortable with that. So said, oh, you need to find someone who's more comfortable in that, go into infectious disease or something like that. So this guy knew what he wanted, knew that he needed the HIV prevention, but wasn't able to find anyone until he was finally able to come into our office. And we were able to do a rapid HIV test in office, and he came back positive. And I know that he could have not been positive if we had better training for our primary care, but also better understanding within the community that those services exist. I think that's a big part of this too.
So it's even like in the education of
Yeah.
medical professionals. Yeah.
I think it's a huge part of it. So like I said, so I graduated med school about 10 years ago now. And even when I went to med school in the South, so it's a little bit different, but I know in general, there's not a lot of education on particularly queer health issues, as well as things like HIV prevention. Even in residency, it was a 1 hour lunch and learn lecture that was optional. But what's really kind of amazing about HIV prevention in particular is we have drugs now that are 99% effective at preventing HIV. And it is an easy once a day kind of pill or an injection that is absolutely something that can be done in primary care offices. It's just about educating the providers and educating the patients to know that that's available.
Yeah. It's very, in certain ways, like not surprising because I've also heard just with some people saying, like, I was told I need to change this, or that, but then they didn't know how to give me the recommendations on my nutrition or this or that because it was like one tiny little section in their training. But in the 80s, we had this huge like HIV epidemic. You would think that like it's been a big deal and we've also come a really long way. So I guess it's just surprising that that wouldn't be more of a like tenet in the model. But I also know that there's so much, I'm sure, in the curriculum that's very interesting though to hear that. I would have, I guess, figured that there would have been more emphasis because of what like a global epidemic it's been, not just here, right, in America, but other parts of.
Yeah, I think unfortunately, when we look at things like HIV prevention or STI prevention in general, a lot of times we run into barriers from cultural things, whether that's, saying that if we're testing for more STDs, that means that we're somehow having more sex and somehow that's a bad thing. Or, I think that there's a lot of societal aspects to it that it just make it a little bit more uncomfortable to talk about things like sex education and sexual health. So I think that's a big part of it. I also think a big part of it is just, like we said, that these predominantly, when we think about things like HIV, it's affecting a lot more of our minority groups. So people like myself in the LGBTQ community, people of color. When we look at rates of new HIV, we see some of the highest rates in women of color, particularly African American and Latinx. So again, I think that the problem we've come from is historically a more patriarchal kind of medical aspect. And so to try to change that and to understand people where they're at, I think that's a big part of education with medicine.
Yeah. Yeah. Wow. Well, thank you for sharing that example too. It's like always good to have examples like that. So, so your practice is here in the Central
Mm-hmm.
Valley, Fresno?
Yep, in Fresno on Chestnut and Herndon.
Okay, cool. And then so you provide like specific health screenings that are more preventative, and what other kind of services are you offering?
Yeah, so as family medicine, we do all sorts of different, we do from birth to death for all of ages. But like I said, we do kind of focus a little bit more because that's my area of focus on the LGBTQ stuff. So yeah, we do specific kinds of screenings for different risk factors. So we do kind of like swabs and other kind of things, as well as doing, like I was telling you, the point of care HIV and offering those other kind of services to help make sure that we're getting everything. And the big part of it, again, is prevention. We don't want people to end up with diseases and issues. We want to stop them before they happen. So when we think about particular people in the queer community, we know that we base things off of a little bit different than the average other person. Like we think about like our cancer screening based more on our anatomy, and so, trans guys still need to get pap smears and things like that that we don't necessarily think, or people engaging in receptive anal intercourse should be getting, pap smears in that too. And that's not a lot of people know about that. So again, trying to help prevent things from happening. That's a big part of our job.
And just being so like welcoming too, because like you said, if people have had bad experiences or maybe even just heard of other people having bad experiences, to go in to the doctor, maybe not you, no offense, but it can be a little scary.
Mm-hmm.
And then you also feel like, man, they got to get me in and get me out in 15 minutes and this and that. And so like, how are they like they don't understand me. And then on top of that, if you don't know if this doctor, if you're just kind of like picking whatever primary care doctor is going to understand like where you're coming from, where your story. So then you have to explain yourself and then gauge like
Mm-hmm.
where are we? And then that's like the 15 minutes. And yeah, so then it feels like, is it even worth it? I'm just kind of like going down that like thought, and that just, yeah, it's that sucks.
It
So
Yeah, and I think that again, certainly we love having a lot of patients and we love to have more patients, but I really think that the biggest thing of this is that we should be educating our doctors that we already have too. And I think that's one of the biggest things that we see within the queer community is that don't be afraid to ask questions. I mean, you deserve to feel safe and respected by your healthcare provider. Like you were talking about looking for clinics that like specify in inclusivity and LGBTQ stuff and certainly ask them too. Like, I think it's a great option for patients when they're first meeting a doctor or a provider to say, here's the kind of things that I want to get into. Is this something you feel comfortable with before we kind of get down this road of 6 months from now saying, hey, I don't know what to do with these things, or I don't know, like I think that's where we have to kind of be our own advocates as patients, particularly queer patients, because again, there's just not a lot of support systemically. So we kind of have to be our own advocates.
Are there any good resources that you're sharing with folks a lot to empower them to be their own advocate?
Yeah, so a lot of it is going to be, really kind of doing a lot of research and being online. There are some good local resources that are helpful. So I don't know if you've ever heard of, so Fresno Inclusive is a new clinic that's being opened recently by a good friend of mine, Dr. Julie Nicole. She's a wonderful OBGYN that focuses in queer health, but particularly in trans men. And they're offering some more resources as well. The LGBT Fresno is a good group around that can help. The EOC LGBTQ Resource Center has some good resources. Trans Emotion has a good kind of compendium of local resources. People outside of just Fresno, but in the Valley, I love The Source in Visalia. They are wonderful people. I've known them for many years now. I'm trying to convince them to come up to Fresno as well. But so there are resources. It is a little bit limited, especially given the size of the city and the fact that we're in California. You'd think that there would be better resources, but we're trying to build that. So that's why we're here.
Thank you.
Hmm.
There's a few psychotherapists I'm aware of in the area that recommend certain gender affirming doctors and things like that. So is that something that you've done, like connected with psychologists like that, where you guys can, or you people, you humans can share resources with each other, in like your own fields?
Yeah, and I think that brings up a good point is that we're not an island, right? So when we're talking specifically about gender affirming care, it is not something we do in isolation. It is a team-based approach when we think about it clinically. And so we work directly with a lot of gender affirming therapists in the area so that we can make sure that we're kind of doing the things that are right by them, both from a medical standpoint, but also from the psychosocial side of things too. So I absolutely think, and we've actually continued over the years to really work closely with people and try to do more kind of meetings of different healthcare providers, meeting different therapists and bringing them together. I know the people at Transemotion do a good job of that, of kind of helping connect people too. But that's incredibly vital for this part is to do it in combination with the whole team.
Yeah. Yeah. So, okay. So, have you done any kind of collaborative events or anything like that? I know the way that we got connected was you reaching out about a potential like Wellness Wednesday situation. So, to be announced if that's going to happen. I'm not sure yet. But so yeah, so is that something that you started developing?
Yeah, so we've done a lot in terms of trying to get out there in the community, meeting people and seeing what the community needs are. I think that we've done different kind of setups at different spots. But kind of talking about it too with the wellness side of things. So certainly we are focusing today on a lot of the LGBTQ plus stuff, but we also do a lot of lifestyle medicine there. So we talk a lot about food is medicine, exercise is medicine. We were talking a little bit before the interview too about yoga and how important that is for mental health and just being that mind body connection. I think that, again, I think that there's a lot more about our health than just prescriptions for things. And I think that when we start to focus a little bit more on those aspects, we tend to see a lot of improvement in our health. And so like community engagement and things like that are really important. Getting socialization, getting all that stuff is good.
Yeah. So amazing. Really wonderful and amazing to hear from a doctor.
Mhm.
That most probably feel that way to a certain degree. It's just it's not something I hear often though. So.
Yeah, and it's really kind of, I don't know, it's kind of unfortunate that we don't talk about it more. But again, like you said, I think that unfortunately, the way that our healthcare system is structured at this point, it's really hard for us to focus a lot on things that are outside the office. And so, like we're talking about with nutrition, we're not going to be able to be there preparing people's meals, and it's hard to kind of take the 15 minutes when we're trying to cover everything in your health to then sit down and talk about simple carbs, complex carbs, like all the other kind of the nuances of nutrition. So I think that's where we tend to have a lot of barriers, and that a lot of providers in general, it's not a top priority. So I think that, again, I think that kind of changing that conversation and shifting things away from what pill can I give you to how can we help you with where you're at and try to get a healthier lifestyle without medication. That's
Yeah,
really my goal.
I love that. And I just sit here and reflect too as you're speaking is we put maybe a lot of pressure just as a society on doctors too. Like you should know everything and be educated in every little area. And like, I can't believe that you weren't more educated on that. And it's like, really, I guess that's why there is specialized sort of sectors. Not that a general, I think education isn't important. Obviously it is. But yeah, like that's a lot. So hopefully when people like yourself can find a need in the space and sort of lean in that direction, something that like speaks to them and that way you can be of service and then as your education grows, like that helps and ripples to other people and maybe eventually it ripples so far out that it does affect like the umbrella of the organization. But I think it does start just like in your own community and it really has to, and sometimes, like, I know that I wanna put the, like, cart before the horse sort of thing. Like, everyone can know about everything now, and I put this on myself too, so, but it's just that's not realistic, you know? Um, yeah, I was just thinking about that too.
Yeah, yeah, I think it is. A lot of times, especially when it comes to our health, we have big goals, but we don't really know how to get there. So a lot of times, every single day in my office, like just right before this, we are talking to someone who's like, "Oh, I want to lose weight," and it's like, that's a great goal, but let's see kind of how can we break it down. And it's like, like they have the old saying, like, how do you eat an elephant? One bite at a time.
Yeah.
So how do we find where we can meet you with where you're at and see how we can make some little goals over the series of weeks to months to start to build that step by step until we are able to make that long-term goal. But I think a lot of times people try to get disheartened by not seeing results right away and feel frustrated, so they end up giving up. So I think that's again where it comes back to your relationship with your provider as well, because it's a lot of that us understanding each other. And if I know that when we're depressed that we tend to eat more, then let's kind of work on that. Kind of that's where again more of the nuance comes in. But I think overall, yes, I think that really kind of focusing on an overall emphasis on healthcare is a good thing.
Yeah, yeah, like, and lifestyle and all those kinds of things, so important. So you've been in the Central Valley for about 10 years now, you said?
No, so I was got out of residency 2019 and moved here. So since 20, I was in stationed with the Navy in Lemoore,
Yeah.
and then when I got out of the Navy, they recruited me up here to Fresno. So I've been up in Fresno now for about 2.5 years.
Wow. Wow. Okay. Okay, cool. So you've started to get a feel for Fresno and for the Central
Hmm.
Valley. Since you've been here, have you noticed any kind of like positive momentum uh in in this specific area and field and need?
Yeah, certainly, like I said, I think that we are seeing some positive changes. It's easy to get kind of depressed on all the bad things that we're seeing on the news and things like that. But I think that we are seeing a lot more providers showing interest in getting training in the LGBTQ plus healthcare and gender affirming care. We're seeing, in general, a lot of insurances are covering a lot of essential services, both from a preventive medicine side of things, but also from a gender affirming side of things. I think that one of the positive spins, I would say, out of all of the recent executive orders and all these other kind of things going through is that there's greater visibility. And I think just like what we're doing right now, I think that we're seeing people outside of our community understanding a little bit of the stuff that we've had to deal with for years. And so it's good to see that there are straight allies out there trying to get us to get more visibility. We still have a long ways to go. I think that especially in the Central Valley, addressing the gaps in rural access to care, especially, and eliminating a lot of discrimination in healthcare, and making sure that, like you're talking about, we have all sorts of different doctors and providers all throughout the healthcare system, and just helping them get educated on how to treat every patient with dignity and respect. I think that's a big part of that too. And so the nice thing from my standpoint from working with community is that they have really been committed to wanting to bring a more inclusive and diverse patient population in, because we know that we're taking care of the entire community. We can't just pick and choose random patients. That we're taking care of the Central Valley, and we need to really focus on that. There is a much more working on getting more education for our providers. And so I'm excited about that. I'm excited that we have support from people. I'm excited about, like I was saying, the Fresno Inclusive Clinic. I think that's super exciting to see that we're actually going to get a queer health center like started. And then hopefully more will come, and we'll have more patients and more providers. I think that it is easy to get disheartened when we're just watching the news. But I think that I actually just came back from doing a training on a new HIV prevention medicine that's an injection every 6 months, which is amazing, phenomenal that we can almost 100% prevent HIV with just 2 shots a year. That's crazy. But it was a national conference, and so there's a lot of people from all over the country who specialize in HIV prevention, and gender affirming care. And so it was really encouraging to see that that still is going on throughout the country. I met someone from where I did residency in South Carolina, and as you know, the laws in California are a little bit nicer for us than South Carolina, but even there, she's still able to do that and to still be able to persevere and to help the patients that really need it. So I think that reality versus the news are two different things. Obviously, we still need to be concerned about the government restricting our healthcare, which is still absurd to think that, that random people get to tell me what my patient can do when they want to. But yes, I think that we still have some ways to go, but I think that we shouldn't be all doom and gloom.
Yeah. Yeah. Wow. Wow. Yeah, what I'm really hearing is it's the education piece. And I can think too, when people are unaware or they don't know how to help, especially if they are in a position to where their life's work is to help,
Mm-hmm.
there can be like a shutdown that happens that even if they wanted to, because they don't know how, like no one wants to feel like, for lack of better words, that they're stupid or have no way to actually like. So I think if people don't have the experience or don't have the education, or whether it's from the academic side of things or even from like in lived experience, when people feel like they don't know when they're supposed to be the one who knows, not just
Mm-hmm.
doctors, it's like shut down. And it's like, we don't need the shutdown. So I appreciate that you're like, ask questions, do this, do that. And it needs to go on both sides though. Like that that doctors who maybe don't have a lot of like lived experience, and I'm hearing don't have the academic like really side of things on how to help, every single community, and this community specifically, it's like, yeah, like let's be curious, ask each other some questions.
Yeah, but I think you hit on a really good point in that I think that there is a certain level of almost like self-conscious or embarrassment when we come across problems that we don't know the answer for and we're supposed to be in a position of authority. I think especially in the doctor's office, I think that can come up a lot. And I think that's where humility and understanding comes in, is that, as a doctor, like you said earlier, it is impossible for me to know everything. That is just inherently, I can't know everything, and I'm going to get some things wrong every once in a while.
You're
But
correct.
being able to acknowledge that and to say, you know what, I don't know the answer for that, but let's go ahead and look into it together. I think it takes a lot to be able to say that, especially like you said, when we come from a culture, particularly doctors, where we get embarrassed by not knowing the answer or get made fun of by our attendings or whatever it was. It's kind of hard to break that cycle. But I think that's really the healthiest way for us to grow, is to ask questions and to learn.
Yeah. Yeah. Wow, this has been very informative. Thank you
Mhm.
so much. Is there anything else that you would like to share, or is there any invitation or like words of encouragement specifically to our LGBTQ plus listeners that might be sitting at home going, I'm terrified to get a checkup?
Yeah. So, like I said, I think that don't be afraid to ask providers. Don't like there are people around here that do openly affirm LGBTQ plus people, but I think in general, really, I think that I am hopeful about the future. I think that we're seeing progress, and like we said, like the new HIV prevention medications that's open for everyone. So that was another great thing that's coming out that they did a study. This is the first HIV prevention that every single person, from kids, from pregnant ladies, from adults, everyone that they studied it for them, and that's really cool that we now have a prevention for everyone. We're seeing huge progress in healthcare, making it more exclusive, but there's still more work to do. And I think that again, it goes back to everyone deserves care that affirms who they are. I think that it shouldn't matter at all. You should just be able to feel comfortable coming into any doctor's office and do that. I'm really grateful that I could be part of it. Like I said, this was not planned at all, but it really has become something that I think that we can really do a lot of great change. So I'm grateful to be a part of that effort. I'm hoping that conversations like this, like what we're doing now, kind of pushes us towards more of an inclusive future as time goes on. And I think that everyone can be a part of this. And whether it's just raising visibility by, putting up a flag, wearing a shirt, talking to people, I think, getting out and when there's rallies, going out to those, calling your politicians and telling them what you're really feeling. I think that now is the time, if we ever were, to be getting engaged in this on a higher level, because we are seeing so many things that people need to start to understand that when we start to restrict people because of who they are, that's a very slippery slope, and it might start with people in the queer community, start with immigrants, but it's not going to stop there.
Mm.
And I think that we really do. We're seeing, talking about women's rights and all these other things, that it's going to slowly continue to chip away at all our rights. So I think that even if you feel like, oh, we're not in this community, oh, this doesn't affect me, it will affect you, and it does affect you in a lot of ways. So I don't think now is the time to be just sitting back and hoping for someone else to do some change. I think we can be the change we want to see.
Mhm. I totally, totally, totally agree. Well, where can people find you, or where do you have a website? Where do they go?
Yeah, so the website's a little long, I think. So probably just Googling my name, like literally, and then, they can also, like I said, my clinic's on Chestnut and Herndon. I can give you the phone number for that's 559-603-7400. If you put my name into Google, it's the first thing that pops up.
And Dr. Andrew C.
Mm-hmm.
I was
That's
typing.
perfect.
Okay, well, beautiful. Thank you so much. And I really, really appreciate your time. And I know you sounds like you're very busy, so I appreciate you spending this time here. And I think that this will be very well received. It's a much needed message. So thank you so much.
Perfect. Thank you so much for having me.
And maybe we'll see you at a Wellness Wednesday event soon.
Yeah, doing some yoga.
Yeah.
Perfect. Bye.